Good evening, y'all. Thank you so much for everyone who is here in attendance for our webinar here, where we're going to hopefully go over some common issues that patients can deal with here and maybe give you guys some options and discussion and go over ways that we can deal with these problems going forward. And at that, we will go ahead and start looking here to get started. So a little bit about myself. My name is Jimmy Kelley, or James Kelley. I am a urologist with the Texas Center for Urology. I see patients over here in Mansfield, Texas, as well as over in Burleson as well, in Fort Worth area. Kind of newer to this area, and we've been trying to meet and help provide, meet the need for patients out in this area that have more urology problems. And I'm hoping that tonight can be of good use for everyone and maybe learn a little bit of something and learn about some ways that we can get everyone back to feeling their best. So let's go ahead and get started. Let's run through some of this, okay? So a little bit about overactive bladder and things on this. You can see a lot of quotes on here. These are things that people will typically say very commonly, have come up with these thoughts before. And this is not unusual. We see this a lot of times in the clinic. I mean, even 44% of people maybe feel embarrassed or don't want to bring these things up to their doctor or their friends. And these are things that I think need to change, and why we have things like this to educate our patients on, so everyone can feel like this is something we can talk about, and that it's not something you have to necessarily live with, but we can deal with this going forward. Next slide. So a little bit about what we're going to be reviewing today. We'll kind of touch base a little bit on kind of bladder control and what the problems that people notice, the care pathway, ways that we can manage these issues and these symptoms, treatment options, the different things that are out there for our patients to help get better with this. And then we'll touch base on a little bit specifically for this talk too, as well, some of these options like the Medtronic systems going forward as well. And then we will definitely save some time here at the end, and we'll go through some question and answer. So anything that you see as we go along, save it up and feel free to ask as we go. And I'll be happy to answer there at the end, and we can kind of chit chat back and forth through the chat function here on the Zoom meeting, okay? So again, like I mentioned, this is a overactive bladder and urinary urgency frequency. This is a very, very common problem. Can affect up to 1 in 6 adults. Just to put that in perspective, it's almost 3 times more than people with just vision problems, as you can see below there, more than adults in America with diabetes. So this overactive bladder, it's something that doesn't necessarily just affect women. This can affect men. And the problem with not doing anything about it is, as you can see, we have issues where you are having trouble sleeping, you get loss of confidence, your self-esteem, all kinds of these things that start to cause problems with your daily life, and are a great reason to look to do something about that. So let's talk about a little bit about what's normal, what's not normal when it comes to our bladders. So ideally, when you are urinating throughout the day, you shouldn't be needing to go more than 8 times a day. When you have to go to the restroom, it shouldn't be a hit you right now, got to rush to the restroom feeling. You shouldn't feel like you have this map planned out on your way to work where you know where every rest stop and gas station is just in case you need to get to the bathroom. Having to limit how much you're going to eat or drink, wearing pads throughout the day. These are all things that your body is telling you something's going on that's not quite normal, and there's ways that we can look at to fix that. But I think it's very common where people think this is just a part of getting older. Maybe I leak, maybe I go more frequently, but it's not something that has to be that way. That's actually kind of more of an abnormal problem. So looking at how our brain and body actually deals with these sensations. So it's a very, very complex network. I won't belabor this issue too much, but knowing that it's a complex system that involves pathways coming down from our brain to our bladder, a lot of nerve intervention, and a lot of signals that go both to and from the bladder that help control. And so any kind of disruption in this or breakdown between those pathways can start to cause problems with our bladder and start to cause issues with our bladder control. So what are some things that can typically cause these bladder control problems? Well, obviously, if we're eating and drinking things that may be causing issues, caffeine, things like that, different medicines we're on, or even just stress on the pelvic floor for our women, meaning after pregnancy or childbirth. All of these things can affect, on top of just those other disruptions in the neural pathways that can cause those issues. So some of the other common bladder control problems that we notice, these are some of the big three that we'll touch on here shortly, but you can see here kind of stress incontinence, where we leak with cough, laugh, sneeze, retention, where you're holding on to your urine when you're not supposed to be, and then this overactive type bladder, where you have that urge, gotta go sensation, and that's sometimes even associated with leakage when you have that severe urgency that comes on. So stress incontinence, this is the cough, laugh, sneeze, bend down, step off the curb, decided to hop on the trampoline with the kiddos, and you leak, have an accident. Or you're having to go all the time to avoid having an accident. When it comes to stress incontinence, it's typically managed with something like a surgical fix. Other issues we see is urinary retention. That's where your bladder can get so full that you can't quite tell that it's full. You have sometimes a weak, just dribbling stream, sometimes even having to use a catheter. And then another one, the big one that we're really going over here, especially today, is this overactive bladder, or OAB. We throw that term around a lot. So with OAB, those are where your bladder gets that sensation. You have to rush to the bathroom right then. You can even have problems where that urge hits you, and then you have a leak before you can make it. Oftentimes you're having to wear pads or some kind of protective underwear or depend. And that's the incontinence side of overactive bladder. There's also just the urgency frequency, meaning you know where every bathroom is on the way to work. You're going more than 8 times a day, and you just feel like your bladder is never empty because you're going so frequently. So good news, and one of the reasons we're here talking today, is there's options. We have a lot of great options and ways that we can get both our men and women with these problems to stop dealing with this frustration, having to know where every bathroom is, and potentially having issues with urinary leakage. So we're going to talk a little bit about ways to kind of get into this rhythm with the overactive bladder, how we diagnose it, ways that we can try to fix it with lifestyle changes, all the way up to some other therapies that we can discuss on ways that we can help get these symptoms better controlled. So obviously the basics, sometimes it just takes a little bit of a lifestyle change. This is typically for my patients that are more on the mild side, obviously, ones that we know are kind of might not need all the extra help, but those are making some adjustments in what we eat, what we drink, sometimes doing these bladder retrainings or pelvic floor strengthening exercises just to help get that bladder control better. We use a lot of medicines often to help with this as well. Downside to some of these medicines, though, is a lot of them have side effects. Side effects like dry mouth, blurs your vision, dry eyes, can get you constipated, and certain types even can raise your blood pressure to a not acceptable level. So it's not like these medications come without problems as well. And as you can see there too, 72% of people, when they start certain medicines for their overactive bladder, stop taking it after 6 months just because they're not fans of the side effects. So even though medicines can be helpful, sometimes they're not enough and they can cause undue side effects for patients. So then we look at some other options, meaning ways that are a little bit more advanced than just taking a medicine. So options like that here on the screen. One that we do is the InterStim system, a sacral nerve stimulator, injection, Botox injections of bladder, the neuro system. All of these are potential options for patients who are still having these symptoms, and either their side effects are too significant or they're just not doing the job. So let's look at these options here one by one for briefly. So Botox is one thing that we use for this overactive bladder urgency frequency. It is something that can temporarily treat the OAB. The medicine gets injected to the bladder. It's typically comparable to different oral medicines. The downside with the Botox is it's not necessarily addressing that communication the bladder has with the nerve pathways to the brain. It also has a potential issue after where you may have to catheterize if you're not able to urinate after, or even have issues with urinary tract infections after. There's also data to suggest that over half of people that get this after their second treatment end up stopping because they're looking at potential other options. So while it is an option, let's look at some other potentials here. So one other is the Medtronic neuro system. Now this is where we do a peripheral nerve stimulation on one of the nerves that kind of feeds back up to the bladder. It's a little bit less invasive. One of the options that it helps is it can restore bladder stimulation by feeding that nerve that can go up into our bladder. Downsides with this one is although it's quick and easy, you have to do 30-minute sessions in the office for up to 12 weeks. So it can be a little bit belaboring. And then we have to do monthly maintenance sessions kind of going forward. So another decent option for certain patients that fit that category. But let's look at one other here. And that's what's called sacral neuromodulation, or a sacral nerve stimulation. So the main nerve that feeds our bladder comes actually from our sacrum, or our sacral nerves in our spinal cord. And so it's been shown that kind of stimulating this pathway of this nerve that feeds the bladder can help both restore bladder and bowel function. A nice bonus of this InterStim technology is you kind of get to try before you buy, so to speak. We do a test trial where we can actually put that lead down towards the sacrum there. You get to test it out over the next week, and you say, oh my gosh, this is fantastic. I'm feeling so much better. And we can then go on to put the permanent lead in, or look at other options if it's not quite working well for you. On that same note, there's even, you can see on here, 2 different sizes. We have some that are rechargeable, non-rechargeable, which would best fit, whichever certain person's lifestyle and different patients' main goals with the treatment. So lots of different ways that we can kind of get this back working for you. So again, one of the nice parts with this InterStim and things that are important to bring up at your doctor's office, or even when you see a urologist or see me, is knowing that this is an option. We can try before we buy. Give this thing a test run, where we put a small little lead there under local anesthetic in the office. Takes me then to go on to do the InterStim device there. So a lot of people obviously would want to know, is this something that's going to be safe, and is it going to work, right? Well, the nice part about this InterStim system, that sacral nerve stimulator, 84% of our patients who use it are very satisfied. It shows the 3 times greater improvements in your quality of life just compared to being on the medicines that have those undue side effects. And then the added bonus here is 3/4 out of our patients can achieve success where they're either dry or using much less pads than they had before, compared to just using medicines there. So it is safe and it's working for our patients. So so some of the reasons we would consider doing this nerve stimulation, obviously for the symptoms we've already talked about before, with the urgency, frequency, trying to do these as well, or having what we call non-obstructive urinary retention, meaning the bladder just isn't quite emptying the way it should, and there's no other anatomic reason why you're not able to get the urine out. Other reasons are you've had these symptoms, we've given these other basic things like lifestyle changes or oral medications a try, and it's just not giving the relief you want, or the side effects are just too bothersome. So at that, what I would go ahead and go into here is looking at going forward. If people have questions, or if you're interested in things like this, we have great options here at my practice with Texas Center for Urology, and we're now offering it here in Mansfield, Texas. As far as the procedures go, these are outpatient things. We get to do the test run, try before we buy, to see if this is something that would be a good fit for you. And so that being said, I thank you guys so much for your time, and we're going to go ahead and try to do some question and answer here. And I have my chat open right here. So I will pop this open where we can see and go over stuff. So if you have any thoughts or questions or concerns, you can go ahead and shout them out, and I will be here to answer them as we go. How long is the test? So if you're referring to the, like I said, that try before you buy, where I do this test in the office, the nerve evaluation that we do in the office takes me all of 10 or 15 minutes. We use local numbing medicine where it's not that uncomfortable. You have the initial just pinch and a burn, like if you had dental work done or stitches placed. We get that lead in the right spot, and we test it before you go, to where you know that you're feeling the sensation that you're supposed to feel there in the sacrum area. And then we have this little external pack that sits there on, that we tape on kind of on your lower back there. And one of the really awesome benefits that we have is one of the representatives from the company that we use is in constant contact with you, checking in, seeing how things are going, see how things are working. And then I personally see my patients the next week, and we touch base, we go through how your symptoms are feeling. And just within that week, we know if this is a device that's going to work great for you, and we can get you scheduled to get that performed, the permanent placement. Great question. Here's a great question here. Can I get an MRI with the implant? So you're right, you saw the pictures of that. It looks like it's a metal device, and that could obviously be a concern. Great news. As of in this last year or two, Medtronic's devices are MRI compatible. So no reason that you'd have to have it explanted or removed before having an MRI. Historically, we had some older devices that, you're right, we couldn't do MRIs below the abdomen. But all the ones that we're implanting now, yes, you can get an MRI performed. Great question. Another question here, is this covered by insurance? So as long as we're following these care pathways and you're a patient that meets the criteria, absolutely, these are covered by insurance. So when we're doing these evaluations in the office, when we've tried these other things, or the side effects are too much for medicines, or you've tried the medicines and they're just not effective, I'm documenting all of this in our notes when we're talking, and those are one of the things that go into play when it comes to the insurance covering it. And as long as you have met those criteria, absolutely, these are things that this kind of test is covered by insurance, and the device is covered by insurance, yes. Great questions, y'all. And while people are kind of thinking or mulling over different questions or what's been going on, I don't know if I did too much of an introduction to myself there too. I know I kind of let you know who I was and where I'm at. But I live here in Mansfield, Texas, been here the last year or so, but I'm a DFW, grew up in Fort Worth, born and raised area. I did my urology training up in West Virginia, West by God, Virginia, and got to come back home. My whole family and my wife's family all live out in this way, and we have two beautiful little daughters, 4 and 1-year-old little Emma Hannah. So we're happy here in Mansfield, and I'm really happy that we get to help more patients out this way. Another question here, how long does it last, and do you have to get it replaced? Great question. So the studies for these show, quote unquote, a 10-year lifespan. That being said, patients that have had these placed over 10 years ago, a fair amount of times are still even working and functioning. That's just as long as the studies went through. So if these things weren't working, or it was a downstream thing where there was issues with the device, half the time, or more than half the time, it's more of a programming function that we just have to adjust or do a little tweak on the programming portion. But very unoften, not very commonly, we can replace it if needed. But these are things that last much long term, and that goes back to those other therapies we were discussing, like the peripheral nerve stimulator, where you're coming in several times a week. Those aren't permanent, or the Botox, that's not a permanent thing. These are things that you have to keep coming back to get done, compared to this InterStim device, where it's there and it provides that sacral nerve stimulation the whole life of the device while it's in there. Yeah, great question. All right, guys. So if there's no more questions, I would be happy to see you here in our office. We've got some information there on the site here with our phone number at Texas Center for Urology, or texascenterforurology.com. I'd love to see you here in the office and help get everyone's symptoms better controlled. If you have questions, concerns, thoughts, always feel free to reach out to our office. I'd be happy to see you. But at that, I will go ahead and end our webinar and look forward to seeing you guys. Thank you so much for attending, and we'll talk to you later.